So yeah, so tonight I chose a mindful awareness meditation because we're working on 3.3 competency, which is about healthy behaviors. And when we talk about mindful awareness, it's usually defined as the state of being present, right? Really coming into the moment of exactly what you're doing at that moment and turning your mind off autopilot. So really focusing in. So if we're ready to get started, just gently close your eyes for a minute, not even a minute, and just start by noticing what is present in your mind and your body at this very moment. And allow your natural breath to settle in. Okay, so let's begin. So if you have your little fruit, take a look at the fruit carefully. Just simply experience what comes to mind as you look at it. The color, the shape. Notice the appearance of the outer skin to the inner fruit. Now, take a hold of it. Hold the section between your thumb and your forefinger. Put it up to your ear and give it a gentle squeeze in front of the ear. And notice your experience of the sound. Now look at it and feel the skin of the fruit. And place it against your lips, but not in your mouth. And allow whatever comes to mind, just to experience that. And now hold it under your nostril and smell it. And notice what is happening in your mouth and your stomach and your mind. And then gently bring it to your lips. And just rub it on your lips. Take a small bite and roll it in your mouth. Don't chew it, just notice the texture. Notice the temperature and the flavor. Now start to chew it very, very slowly. And notice the evolving taste. Notice the evolving texture. Begin to just savor the taste, the texture, the moment, and notice when you begin to swallow. Now just take a moment, keep your eyes closed, and what sensations did you experience? What did you notice that maybe you never noticed about eating this piece of fruit before? So now I'm just going to open it up for everybody. And if anybody wants to come forward, just notice just yell out what the experience was like for you. What did you notice about eating this fruit that you haven't noticed before? Or what sensations did you experience?
More of the textures and the flavors. I did like this seaweed curry cracker. So I tasted the seaweed as it got softer in my mouth, and the flavors of the curry and the sesame seeds.
Wow, so it sounded like it really started to break down for you.
Yes, almost like liquefied before.
Yeah. How many times do we throw snacks in our mouth and it's just like chop chop chop, doom, chop chop chop, chop chop chop.
Yeah.
Eating so quick.
I used to always tell my kids, like, our stomach doesn't have what? Teeth.
Yeah, right. Right.
I loved when you invited us to check in and see what our stomach and our mind was also, and I think you had one other thing that you invited us to check in with.
Right. Your mind, your stomach, and your mouth, like what was happening before it went into your body.
Right. That was cool.
Yeah.
Right, as we smelled it.
Right. Because sometimes the stomach already starts growling and the mind already gets a sensation like, okay, here it comes. I'm waiting for it. Just that anticipation, kind of like, when you want your ice cream or your sweet or something like that. So I'm just going to do a quick reading by Thich Nhat Hanh, who's one of the Zen Buddhist greats. He did a series of books. They're really cute pocket books. This one is How to Eat. And it's all these little short essays of his on specifically eating. So I'll just read this. And I love to read these to my kids too before we eat dinner sometimes, or breakfast, just to slow everybody down and kind of settle everyone, instead of just like everybody eating quickly out of the room. Nobody's having conversations. Everybody's already off doing their own thing, rather than just spending like 10 minutes. How long do we eat together anymore? 10 minutes is like a long time if we're all in the same room together with everybody's schedules. So this is one of his first passages called Mindful Eating. To cultivate mindfulness, we can do the same things we always do: walking, sitting, working, eating, and so on, with mindful awareness of what we are doing. When we're eating, we know that we are eating. When we open a door, we know that we're opening a door. Our mind is with our actions. When you put a piece of fruit into your mouth, all you need is a little bit of mindfulness to be aware. I am putting a piece of apple in my mouth. Your mind doesn't need to be somewhere else. If you're thinking of work while you chew, that's not eating mindfully. When you pay attention to the apple, that is mindfulness. Then you can look more deeply, and in just a very short time, you will see the apple seed, the beautiful orchard, the sky, the farmer, the picker, and so on. A lot of work is in that apple. So thanks for listening.
No, that's wonderful. Thank you.
Love it.
I know. I so love it. And I've never taken note, like I know strawberries have seeds, but so many seeds. So many little seeds.
So I believe Teresa is presenting tonight. And Teresa, are you comfortable with just giving like a disclaimer?
Actually, you do it so well. Would you mind?
No,
I don't know if I'll remember everything, and you do it so well.
Oh, well, thank you. I feel like I just say it. Okay, so no one here is a paid professional. So any information that we speak, it is not because any one of us has taken the exam or the national board exam that we have experience with it, and then we're giving away any information that's on it. We are just basing everything that we speak about based off the competencies that is provided by the National Board of Medical, or by the National Board of Health and Wellness Coaches. And if anybody talks about whenever I took the test, they're talking about when they took a test or an exam with the place that they got their certification through, so that they could actually sit for the board. So we're going to say what's to the best of our knowledge, and any one of us can misspeak, and it is our own responsibility to either help and correct each other, or explain why we think this could be right or not right. And also, just we have to do our own research. So any information that you hear, just know it is still your personal responsibility to make sure that what you hear is correct. And Teresa has gone ahead and let me know what document she's using. So it is on the Facebook group, and it is on Guide 11. So you guys are more than welcome to go ahead and download it, but she's going to be going over with it. She's going to be using it and probably be sharing it on her screen as well. Okay, so I'm going to turn it over to Teresa. Thank you.
Thank you.
Awesome. Thank you, Sherry. All right, I'm going to attempt to share my screen here. Oh, okay.
We have to multiple participants.
Yeah, it's not. Let's see, is it working? Let's try this. Okay. Everybody see this? All right, you can see this. Great. Awesome. So I'm really excited to be here with all of you tonight presenting 3.3. So we are going to be going over health behaviors, social and behavioral risk factors. This presentation has about 90 slides. I'm not kidding. It's a lot of information to get through. And I really want to get to the test questions as well. So I'm going to be going through some of these things a little bit more quickly, but I want this to be very collaborative. Feel free to jump in, share whatever information you would like at any point during this tonight. So yeah, all right, let's just get started. So 3.3, here we go. All right, 3.3.1, healthy weight. All right, so from the Healthy People, 2022, actually, oops.
Hold on, I'm
sorry.
gonna interrupt you for 1 second. So Teresa,
Yes.
on the bottom of your screen where it shows your minus and plus and it's got the 115%, directly to the left of that is a print. Nope, the other left.
Oh, this one. No,
Nope, right beside of the minus.
this one.
If you click that, that will be the slideshow. Full
Oh,
screen.
there we go. Okay.
Okay, thank you. Sorry about that.
Here, let me see. I can't read all of it. Maybe I'll go this way. Okay, there. Now I can't see you. Okay, Healthy People 2020. Americans with a healthful diet consume a variety of nutrient-dense foods within and across the food groups, especially whole grains, fruits, vegetables, low-fat or fat-free milk or milk products, and lean meats and other protein sources. Limit the intake of saturated and trans fats, cholesterol, added sugars, sodium, and alcohol. Limit caloric intake and meet caloric needs. Individuals who are at a healthy weight are less likely to develop chronic disease risk factors such as high blood pressure and dyslipidemia, develop chronic diseases such as type 2 diabetes, heart disease, osteoarthritis, and some cancers, experience complications during pregnancy, and they're also less likely to die at an earlier age. Oh, it's not letting me.
Just hit your
go to
right
the next
arrow.
slide. Yeah, that's what I'm doing. It's not letting me.
How about your down
Weird.
arrow?
No. Let's see. Why is it doing this? Okay, I'll just use this. I found something else. Okay, so, and I apologize, this is a lot of data, so but we'll get through it. A healthful diet also helps Americans reduce the risks for many health conditions, including obesity, malnutrition, iron deficient anemia, heart disease, high blood pressure, poor lipid profiles, type 2 diabetes, osteoporosis, oral disease, constipation, diverticular disease, and some cancers. All right, so understanding nutrition and weight loss. Interventions to support a healthier diet can help ensure that individuals have the knowledge and skills to make healthier choices, and healthier options are available and affordable. Right, social factors thought to influence diet include food assistance programs, food and agricultural policies, personal knowledge and attitudes, personal skills, social support, societal cultures, norms, and cultural norms, economic price systems. So there's a really helpful little formula here to help learn these, which on the bottom you'll see is F squared, P squared, S squared plus E. So F, the two F's squared, P squared, S squared, the two social support, societal, and E. All right, physical factors that influence diet. Access to healthy food, for example, better access to retail venues that sell healthier options may have a positive impact on a person's diet. These venues may be less available to low-income or rural neighborhoods. Also, places where people go to eat, for example, foods eaten away from home often have more calories and are of lower nutritional quality than foods prepared at home. Marketing also influences people's, particular children's food choices. Risks associated with being overweight: heart disease, stroke, diabetes, some cancers, and depression. And I feel like this little note at the bottom is really good to remember, because I feel like I've seen this somewhere, maybe in one of the tests or the test questions that I've seen posted around. Losing 5% of body weight can significantly decrease the risk. All right, optimal nutrition and hydration, 3.3.2. A healthful diet includes consuming a variety of nutrient-dense foods within and across the food groups, especially whole grains, fruits, vegetables, low-fat or fat-free milk or milk products, and lean meats and other protein sources. Limit the intake of saturated and trans fats, cholesterol, added sugars, salt, and alcohol. Limit caloric intake to meet caloric needs. All right, so this is the Harvard Healthy Eating Plate. All right, let's go over this. So let's start with whole grains. Eat a variety of whole grains like whole wheat bread, whole grain pasta, and brown rice. Limit refined grains like white rice and white bread. Healthy protein: choose fish, poultry, beans, and nuts. Limit red meat and cheese. Avoid bacon, cold cuts, and other processed meats. Fruits: eat plenty of fruits of all colors. Vegetables: the more veggies and the greater the variety, the better. Potatoes and French fries don't count, even though we would sometimes want them to. Healthy oils: use healthy oils like olive and canola oil for cooking, on salad, and at the table. Limit butter. Avoid trans fat. Water: drink water, tea, or coffee with little or no sugar. Limit milk, dairy to 1 or 2 servings a day, and juice to 1 small glass a day, and avoid sugary drinks. Okay, let's dive into this eating plate a little bit more. So the main message of the healthy eating plate is to focus on diet quality. So it's the type of carbohydrate in the diet that's more important than the amount of carbohydrate in the diet, because some sources of carbohydrate, like vegetables other than potatoes, fruits, whole grains, and beans, are healthier than others. The healthy eating plate also advises consumers to avoid sugary beverages, a major source of calories, usually with little nutritional value in the American diet. The healthy eating plate encourages consumers to use healthy oils, and it does not set a maximum on the percentage of calories people should get each day from healthy sources of fat. In this way, the healthy eating plate recommends the opposite of the low-fat message promoted for decades by the USDA. Okay, moving on to my plate. All right, my plate. Make half your plate fruits and vegetables. Focus on whole fruits, and then vary your veggies. Make half your grains whole grains. Vary your protein routine, and move to low-fat or fat-free dairy milk or yogurt, or lactose-free dairy or fortified soy versions. Okay, the differences, and I think this is really important to know. Harvard has more emphasis on quality. Also, it encourages focusing on whole grains, limiting refined grains. Does not include potatoes or French fries within veggie category, and my plate is more vague about that. Fruits of many colors. It includes healthy fats. Encourages healthy proteins such as fish, nuts, beans, while limiting saturated fats like cheese, red meat, cold cuts, etc. It encourages water or sugar-free coffee/tea and warns against sugary beverages. It also encourages staying active. And the My Plate, it encourages whole fruits, vary veggies, but it's vague on what counts. Make half of grains whole grains. Vary your protein, but it does not get more specific. Low fat, fat-free dairy milk or soy milk at meals. Nothing on activity and nothing on water. All right, My Plate fruit recommendations. So the age group here on the left, 18 to 30, men 2.2 to 2.5 cups, women 1.5 to 2 cups. The age group of 31 to 59, 2 to 2.5 cups, 1.5 to 2 cups. 60 plus, 2 cups. for men and 1.5 to 2 cups for women. All right, my plate veggie recommendations. The age 18 to 30 for men, 3 to 4 cups, women, 2.5 to 3 cups. Ages 31 to 59 for men, 3 to 4 cups, and women, 2 to 3 cups. 60 plus for men, 2.5 to 3.5, women, 2 to 3 cups. All right, the DASH eating plan, and DASH stands for Dietary Approaches to Stop Hypertension. So DASH is a flexible and balanced eating plan that helps create a heart-healthy eating style for life. The DASH diet lowers blood pressure and LDL, which is the bad cholesterol compared with the typical American diet alone, or typical American diet with more fruits and vegetables. The DASH eating plan requires no specific foods and instead provides daily and weekly nutritional goals. This plan recommends eating vegetables, fruits, and whole grains, including fat-free or low-fat dairy products, fish, poultry, beans, nuts, and veggie oils, limiting foods that are high in saturated fat, such as fatty meats, full-fat dairy products, and tropical oils, such as coconut, palm kernel, and palm oils, and limiting sugars, sweetened beverages, and sweets. So I won't go through all of these based on food group. You can see the chart here of how many servings based on food group, which is in this DASH eating plan. And to note, I think on this slide is that 1,500 milligrams of sodium lowers blood pressure even further than the 2,300 milligrams of sodium daily. All right, the Mediterranean diet. So it's an emphasis on olive oil, fruits, vegetables, nuts and seeds, beans, legumes, seafood, selective dairy intake, and whole grains. It limits red meat, little or no red meat, choosing poultry instead of red meat, little or no sweets, sugary drinks, or butter, moderate wine intake. It's associated with increased longevity, preserved cognition, reduced risk for some cancers, and lowers risk for CVD. Emphasis on fish, veggies, beans, and olive oil. We all know about the blue zones and the Mediterranean diet. All right, we talked about that a couple weeks ago. All right, the arthritis anti-inflammatory diet. So while there's no specific diet that people with rheumatoid arthritis should follow, researchers have identified certain foods that can help control inflammation. Many of them are found in the so-called Mediterranean diet, which emphasizes fish, vegetables, and olive oil, among other staples. So foods that promote inflammation that should be avoided are refined carbs, such as white bread and pastries, French fries and other fried foods, soda and other sugar-sweetened beverages, red meat like burgers, steaks, and processed meats, hot dogs, and sausage, margarine, shortening, and lard. And to choose foods that fight inflammation, like tomatoes, olive oil, green leafy veggies, such as spinach, kale, and collards, nuts like almonds and walnuts, fatty fish like salmon, mackerel, tuna, and sardines, and fruits such as strawberries, blueberries, cherries, and oranges, which I think some of you ate tonight. All right, benefits of drinking water. So water helps your body keep a normal temperature, lubricate and cushion joints, protect your spinal cord and other sensitive tissues. It gets rid of wastes through urination, perspiration, and bowel movements. And your body needs more water when you are in hot climates, more physically active, running a fever, or having diarrhea or vomiting. And I'm sure we've all experienced probably at least one of those. All right, the vital function of water. It forms saliva and helps digestion, flushes waste out of the body, it lubricates and cushions joints, regulates body temperature, protects the spinal cord and sensitive tissues. It's a shock absorber for the brain and spinal cord. Factors that influence hydration needs: exercise, illness, environment, pregnancy and breastfeeding, and increase in urination. Signs of dehydration: thirst, darker urine, decrease in urine output, feeling dizzy or lightheaded, fatigue, dry mouth, lips or eyes, and constipation. And on that note, I'm going to take a sip of water.
I'm really surprised
you.
headache isn't on there.
That's a really good point. That's exactly what happens to me. All right, weight loss. No one size fits all approach. Right. So according to the NIH, a safe and successful weight loss program should include behavioral treatment. I think I'll just do the headlines for these bullet points. Behavioral treatment, information about getting enough sleep, managing stress and benefits and drawbacks of weight loss, ongoing feedback, monitoring and support, slow and steady weight loss goals, usually 1 to 2 pounds per week. The weight loss may be faster at the start of a program. A plan for keeping the weight off, including journal setting, self-checks, such as keeping a food journal and counseling support. The most successful weight loss programs provide 14 sessions or more of behavioral treatment over at least 6 months and are led by trained staff. Okay. Online weight loss programs should provide the following: organized weekly lessons offered online or by podcast and tailored to your personal goals. Also support from a qualified staff person to meet your goals. A plan to track your progress on changing your lifestyle habits, such as healthy eating and physical activity, using tools such as cell phones, activity counters, and online journals. Regular feedback on your goals, progress, and results provided by a counselor through email, phone, and text messages. The option of social support from a group through bulletin boards, chat rooms, or online meetings. Weight loss programs to avoid. Avoid weight loss programs that make any of the following promises: lose weight without diet or exercise, lose weight while eating as much as you want of all of your favorite foods, lose 30 pounds in 30 days, lose weight in specific problem areas of your body. Other warning signs to look out for include very small print, asterisks, and footnotes, which may make it easy to miss important information, before and after photos that seem too good to be true, personal endorsements that may be made up. All right, moving on to 3.3, physical activity and sedentary lifestyle. Okay, so requirements for adults. So the example one, moderate intensity aerobic activity is such as brisk walking for 150 minutes every week, for example, 30 minutes a day for 5 days a week. And muscle strengthening activities on 2 or more days a week that work all major muscle groups: legs, hips, back, abdomen, chest, shoulders, and arms. In example 2, which is vigorous intensity aerobic activity, such as jogging or running for 75 minutes, 1 hour and 15 minutes every week, and muscle strengthening activities on 2 or more days a week that work all major muscle groups: legs, hips, back, abdomen, shoulders, and chest. Example 3 is an equivalent mix of moderate and vigorous intensity aerobic activity on 2 or more days a week, and also the same muscle strengthening activities I just listed. Okay, so this is the requirements for older adults. The first example, moderate intensity aerobic activity, such as brisk walking for 150 minutes, for example, 30 minutes a day, 5 days a week. Muscle strengthening activities on 2 or more days a week that work all major muscle groups: legs, hips, back, abdomen, chest, plus balance activities, walking heel to toe or standing from a sitting position. Example 2, vigorous intensity aerobic activity, such as jogging or running for 75 minutes, 1 hour and 15 minutes every week, and the muscle strengthening activities on 2 or more days a week that work all major muscle groups: legs, hips, back, abdomen, chest, shoulders, and arms, plus the balance activities, walking heel to toe or standing from a sitting position. And then the example 3, an equivalent mix of moderate and vigorous intensity aerobic activity on 2 or more days a week, and the muscle strengthening activities, and plus the balance activities. So really the difference between adults and older adults is that it's the additional balance activities.
I just wanted to say older adults is 65 or older on the CDC's webpage.
Mm-hmm. Thank you. All right, requirements for chronic conditions and disabilities. Adults with chronic conditions and disabilities and health conditions or disabilities should get at least 150 minutes, for example, 30 minutes, 5 days a week of moderate intensity aerobic physical activity a week, and get at least 2 days a week of muscle strengthening activities that include all major muscle groups. If you are unable to meet the recommendations, be as active as you can and try to avoid inactivity. The benefits, it supports daily living activities and independence. It immediately helps you feel, function, and sleep better, helps control weight and improves mental health by reducing depression and anxiety, lowers the risk for early death, heart disease, type 2 diabetes, and some cancers, decreases pain and improves function in people with osteoarthritis. It improves cardiovascular health, muscle fitness, and brain health. Examples of physical activity: aerobic, walking, wheelchair rolling or biking to places, swimming or water aerobics. For muscle strengthening, some yoga postures, strengthening exercises using exercise bands, weight machines, and handheld weights. Okay, the requirements for if you're pregnant and breastfeeding. So according to the Physical Activity Guidelines for Americans, 2nd edition, pregnant or postpartum women should do at least 150 minutes, for example, 30 minutes a day, 5 days a week, of moderate intensity aerobic physical activity per week, such as brisk walking during and after their pregnancy. It is best to spread this activity throughout the week. Women who are already do vigorous intensity aerobic physical activity, such as running, can continue doing so during and after their pregnancy. All right, so how do we remember all of this? Older adults have the same requirements as adults with the addition of the balance activities. Chronic conditions and disabilities require only 150 minutes of moderate aerobic activity with 2 days of strength training or whatever they are able to do. There's no vigorous. Pregnant women only need to worry about 150 minutes of moderate aerobic activity, preferably 30 minutes a day, unless they did vigorous exercises pre-pregnancy, and then they can continue with that. All right, aerobic activities. Moderate intensity includes walking fast, doing water aerobics, riding a bike on level ground or with few hills, playing doubles tennis, pushing a lawnmower. Vigorous intensity, jogging or running, swimming laps, riding a bike fast on hills, playing singles tennis, playing basketball. So a rule of thumb is that 1 minute of vigorous intensity activity is about the same as 2 minutes of moderate intensity activity. All right, per the CDC, any amount of time is fine. We know 150 minutes each week sounds like a lot, but you don't have to do it all at once. Not only is it best to spread out your physical activity during the week, but you can break it up into smaller chunks of time during the day. As long as your aerobic physical activity is a moderate or vigorous effort, any amount of time counts toward meeting the aerobic guidelines. All right, muscle strengthening activities, lifting weights, work with resistance bands, do exercises that use your body weight for resistance, like push-ups and sit-ups, dig in a garden, do some yoga. The benefits of physical activity: reduced risk of cancer, at a greater number of sites. Brain health benefits, including possible improved cognitive function, reduced anxiety and depression risk, and improved sleep and quality of life. For pregnant women, a reduced risk of excessive weight gain, gestational diabetes, and postpartum depression. For older adults, reduced risk of fall-related injuries. For people with various chronic medical conditions, reduced risk of all-cause and disease-specific mortality, improved physical function, and improved quality of life. All right, moving on to sleep, 3.3.4. Overview of sleep. About 1 in 3 adults and even more adolescents don't get enough sleep, which can affect their health and well-being. People who don't get enough sleep are more likely to have health problems like obesity, diabetes, heart disease, stroke, dementia, cancer, and they're also more likely to have trouble at work or school. In addition, about 100,000 motor vehicle crashes every year in the United States are related to drowsy driving. And this was taken from the health.gov Healthy People website. All right, key sleep disorders: insomnia, characterized by an inability to initiate or maintain sleep, may also take the form of early morning awakening, in which the individual awakens several hours early and is unable to resume sleeping. Narcolepsy, excessive daytime sleepiness, includes episodes of irresistible sleepiness, combined with sudden muscle weakness, are the hallmark signs of narcolepsy. The sudden muscle weakness seen in narcolepsy may be elicited by strong emotion or surprise. RLS is characterized by an unpleasant creeping sensation, often feeling like it is originating in the lower legs, but often associated with aches and pains throughout the legs. This often causes difficulty initiating sleep and is relieved by movement of the legs, such as walking or kicking. Sleep apnea. Snoring may be more than just an annoying habit. It may be a sign of sleep apnea. Persons with sleep apnea characteristically make periodic gasping or snorting noises, during which their sleep is momentarily interrupted. Those with sleep apnea may also experience excessive daytime sleepiness, as their sleep is commonly interrupted and may not feel restorative. Insufficient sleep. So insufficient sleep has been linked to the development and management of chronic diseases such as type 2 diabetes, CVD, depression, and anxiety. CDC sleep hygiene tips: be consistent, go to bed at the same time each night, and get up at the same time each morning, including the weekends. Make sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Remove electronic devices such as TVs, computers, and smartphones from the bedroom. Avoid large meals, caffeine, and alcohol before bedtime. And get some exercise. Being physically active during the day can help you fall asleep more easily at night. And I think with us, all studying for this test, I think, at least for me, I won't speak for everyone, but, sometimes I'm reading the books late at night, or I'm like, one more page, and then I stay up too late. So I thought it might be fun here, if you guys want to put in the chat, like, what other sleep hygiene tips can we share with each other, during sort of this crunch time where, we might be up a little bit later and it could potentially affect our sleep. So if you have any good tips, go ahead and put them in the chat and share some more sleep hygiene tips. And while you're doing that, I'm going to keep going, but I would love to see if you guys have some more sleep hygiene tips for us. All right, sleep requirements, adults. 18 to 60 years old should get 7 or more hours per night. 61 to 64 years, 7 to 9 hours. 65 years and older, 7 to 8 hours. Okay. 3.3.5, social and emotional wellness. Social determinants of health. Social and community contacts, healthcare access and quality, economic stability, education access and quality, and neighborhood and built environment. So the tip here is to use SHEEN as an acronym to help remember. So SHEEN. Sherry, I still can't get some of your acronyms out of my head. So thank you.
I'm
for
sorry.
That. No, I love it. I love it. I love it. All right. Mental health definitions from the CDC. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Mental health is important at every stage of life, from childhood, adolescence, through adulthood. All right, that was from the CDC. From WHO, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right, and it is crucial to personal, community, and social economic development. All right, moving on to depression, the risk factors, biochemistry, genetics, personality, and environmental. The symptoms, feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss, or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless physical activity or the inability to sit still, pacing, hand wringing, or slowed movements of speech. These actions must be severe enough to be observable by others. Also, feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, and thoughts of death or suicide. Anxiety disorders. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, specific phobias, agoraphobia, social anxiety disorder, and separation anxiety disorder. And specific phobias, 18 to 12% of anxiety disorders. Social anxiety disorders, 7%. Panic disorder, 2 to 3%. Generalized anxiety disorder, 2%. Agoraphobia, 1 to 2.9%. And separation anxiety disorder is 0.9 to 1.9%. And that was taken from psychiatry.org. I don't know if you have any pets, but I have a friend who has a dog that has severe separation anxiety. So, all right, how stress affects the body. So in this graph, you'll see it affects the musculoskeletal system, which can affect the respiratory system, cardiovascular system, the endocrine system, gastrointestinal system, nervous system, and the reproductive system. This was taken from the APA.org. Stress can cause the following: feelings of fear, anger, sadness, worry, numbness, or frustration, changes in appetite, energy, desires, and interest, trouble concentrating and making decisions, nightmares or problems sleeping, physical reactions such as headaches, body pain, stomach problems, or skin rashes, worsening of chronic health problems and mental health conditions, increased use of alcohol, illegal drugs, and misuse of prescription drugs like opioids. All right, coping with stress. Take breaks from news stories. Take care of your body. Staying physically healthy can improve your emotional well-being. Here are some ways to improve your health. Eat healthy, get enough sleep, move more, and sit less. Limit alcohol intake. Avoid using illegal drugs or prescription drugs in ways other than prescribed. Avoid smoking, vaping, and the use of other tobacco products. Continue with regular health appointments, tests, screenings, and vaccinations. Make time to unwind and also connect with others. Relaxation techniques. Progressive relaxation. It's also called progressive muscle relaxation. This technique involves tensing different muscles in the body and then releasing the tension. Autogenic training through a series of mental exercises involving relaxation and ideas that someone suggests to themselves, autosuggestion. Their mind focuses on their body's experience of relaxation. Guided imagery or visualization is in guided imagery, the individual pictures objects, scenes, or events associated with relaxation or calmness and attempts to produce a similar feeling in their body. Biofeedback assisted relaxation, an individual learns how to recognize and manage their own body or how their own body responds through feedback usually provided by an electronic device. The electronic device lets them see how their heart rate, blood pressure, or muscle tension changes when feeling stressed or relaxed. Self-hypnosis. In self-hypnosis programs, people learn to produce a relaxation response when prompted by a phrase or nonverbal cue called a suggestion. Breathing exercises. For breathing exercises, an individual might focus on taking slow, deep breaths, also called diaphragmatic breathing. And of course, Claire has led us in some of these very lovely techniques we've experienced. All right, 3.3.6, avoiding tobacco use. All right, an overview. Smokers have a 2 to 4 times higher risk for developing heart disease or having a stroke compared to non-smokers. Smokeless tobacco causes several serious oral health problems, including cancer of the mouth and gums, periodontitis, and tooth loss. Tobacco use causes cancer. I won't list all of them, but you can see them listed there. Heart disease and stroke, lung diseases, reproductive effects, other effects like type 2 diabetes, age-related macular degeneration, rheumatoid arthritis, blindness, cataracts, hip fractures, impaired immune function, periodontitis, and overall diminished health. All right, so the Healthy People 2020 tobacco use objectives are organized into 3 key areas. Number 1, tobacco use prevalence. Implementing policies to reduce tobacco use and initiation among youth and adults. Number 2, health system changes. Adopting policies and strategies to increase access, affordability, and use of smoking cessation services and treatments. Number 3, social and environmental changes. Establishing policies to reduce exposure to secondhand smoke, increase the cost of tobacco, restrict tobacco advertising, and reduce illegal sales to minors. Smoking health effects. More than 16 million Americans are living with the disease caused by smoking. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive pulmonary disease, or COPD, which includes emphysema and chronic bronchitis. Smoking also increases the risk for tuberculosis, certain eye diseases, and problems of the immune system, including rheumatoid arthritis. Secondhand smoke exposure contributes to approximately 41,000 deaths among non-smoking adults and 400 deaths in infants each year. Secondhand smoke causes stroke, lung cancer, and coronary heart disease in adults. Children who are exposed to secondhand smoke are at increased risk for sudden infant death syndrome, acute respiratory infections, middle ear disease, more severe asthma, respiratory symptoms, and slowed lung growth. Smoking health effects. Cigarette smoking causes more than 480,000 deaths each year in the United States. This is nearly 1 in 5 deaths. Smoking causes more deaths each year than the following causes combined: HIV, illegal drug use, alcohol use, motor vehicle injuries, and firearm-related incidents. More than 10 times as many US citizens have died prematurely from cigarette smoking than have died in all of the wars fought by the United States. I was shocked to read that. Smoking causes about 90% or 9 out of 10 of all lung cancer deaths. More women die from lung cancer each year than from breast cancer. Smoking causes about 80% or 8 out of 10 of all deaths from COPD. Cigarette smoking increases risk for death from all causes in men and women. The risk of dying from cigarette smoking has increased over the last 50 years in the United States. Estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing lung cancer by 25 times, of women developing lung cancer by 25.7 times. Smoking causes diminished overall health, increased absenteeism from work, and increased healthcare utilization and cost. Smokeless tobacco causes a number of serious oral health problems, including cancer of the mouth and gums, periodontitis, and tooth loss. All right, common withdrawal symptoms when trying to quit smoking. Having urges or cravings, feeling tired, irritated, or grouchy, feeling jumpy or restless, having a hard time concentrating, having trouble sleeping, feeling hungrier or weight gain, and feeling anxious, sad, or depressed. Tips for quitting: adjust your medicine, make your environment work for you, distract yourself, find safe substitutes for cigarettes, listen to what the urge says, then talk back, and ride the waves.
Can I just jump in a second about quitting? Some of the questions that I've noticed come up on all the different types of exams that I had taken, not the national board, but when it comes to tobacco, 2 questions that came up several times was, what is the #1 leading cause of preventable death? And smoking is. So smoking is the leading cause of preventable death in the United States. The other question about tips for quitting type of thing, but from an MI perspective, there are different MI techniques to use that came up on the questions for quitting. And the 4 that came up was MI principle empathy, MI principle develop discrepancy, MI principle roll with resistance, and MI principle support self-efficacy. So, and I'd seen those several times in different scenario questions.
Awesome. Thanks for that, Claire. Okay. So 5 steps of a quit plan. Choose your quit date, determine how much smoking costs, determine the why or reasons for quitting, know your triggers, and set yourself up with strategies and tools for quitting. Okay, moderate or no alcohol use and substance abuse, 3.3.7. All right, this is the last one. All right, alcohol use. We went through this a little bit last week, but the recommendations: 1 drink per day for women, 2 drinks per day for men. binge drinking 4 or more drinks on occasion for a woman, 5 or more drinks on occasion for a man, heavy drinking 8 or more drinks per week for a woman, and 15 or more drinks per week for a man. Fast stats. So each year in the United States, excessive alcohol use is responsible for 140,000 deaths, shortening lives by an average of 26 years. 1 in 5 deaths among adults ages 20 to 49, and 249 billion or more in economic costs, or 2.5 cents a drink, or $2.05 a drink. The health effects of excessive alcohol use. Chronic diseases and other serious problems, including alcohol use disorder, problems with learning, memory, and mental health, high blood pressure, heart disease, stroke, liver disease, and cancer, intermediate injuries, violence and poisoning, unintended pregnancy and sexually transmitted infections, and poor pregnancy outcomes. Okay, opioids.
So
The
I'm
most
gonna, I'm sorry, Mr.
back.
Sherry. Yeah, if you keep
Yeah.
it there. So one of the things that I noticed on here was obesity wasn't a health effect of excessive alcohol use. So there were a lot of different scenarios. There's a ton of different cancers, but alcohol use or obesity and being overweight was not one of them associated with excessive or binge drinking.
Yeah, I thought that was interesting. All right. Opioids. The most common drugs involved in prescription opioid overdose deaths include methadone, Oxycontin, and Vicodin. The most commonly prescribed opioids include the following: Vicodin, Percocet, Opana, Avinza, codeine, fentanyl, hydromorphone, tapentadol, and methadone. The use of prescription opioids can have a number of side effects even when taken as directed. Tolerance, meaning you might need to take more of the medication for the same pain relief. Physical dependence, meaning you might have symptoms of withdrawal when the medication is stopped. Increased sensitivity to pain, constipation, nausea, vomiting, and dry mouth. Sleepiness and dizziness, confusion, depression, low levels of testosterone that can result in lower sex drive, energy and strength, and itching and sweating. Right, the stats. There were nearly 5 times the number of overdose deaths involving prescription opioids in 2020 than in 1999. In 2020, almost 24% of all US opioid overdose deaths involved a prescription opioid. More than 263,000 people have died in the United States from overdoses involving prescription opioids since 1999. All right, here we go. Some practice questions. All right, it is recommended pregnant women's physical activity prescription per week should include A, 75 of vigorous and 150 minutes of moderate intensity during pregnancy and postpartum, or B, no vigorous intensity while pregnant, C, 150 minutes of moderate physical activity during pregnancy and postpartum, or D, a gradual increase to 90 minutes of vigorous activity while pregnant. What do we think?
C. So we got about 7 C's in your chat.
Okay, let's see what it is. Yay! C, 150 minutes of moderate physical activity during pregnancy and postpartum. Awesome. All right, a 34-year-old woman came into her first coaching session with the results of her physical from the primary care provider. She indicated that she was worried about her BMI. The coach asked her if she had her waist circumference measured as well. What additional information would knowing their client's waist circumference add to their overall metabolic profile? A, amount of subcutaneous fat. B, estimate of risk of cardiovascular disease. C, amount of total body fat. Or D, estimate of waist to hip ratio. What do we think?
D.
I'm sorry, what did you say?
Is it D?
D? Okay, I can't see the
D.
chat here. Let me look.
B.
I'm
You
gonna
think
say
B? Okay, let's see what it is. B, because it's metabolic.
Don't forget, metabolic syndrome is weight in pounds, WTLBS. The W is for waist circumference. And that gives you a larger risk of cardiovascular disease, CVD, and other heart diseases.
Mhm. All right, let's do another one. Which of the following health metrics is a screening measure of body fat based on height and weight? A, bioelectrical impedance derived weight. B, body mass index. C, hydrostatic weighing. D, skin fold measurements. Or E, waist circumference. What do we think?
Got about
Chef?
5, 6 B's in the chat.
All right. It is B, body mass index. Okay. Do another one. A client came to her first session from their provider's office with a list of their biometrics. Blood pressure 118/72, LDL 775, waist to hip ratio 0.95, physical activity, yoga/strength training, 60 minutes 3 times per week and running, 30 minutes 5 times per week, A1C 7.2%. Which of the following is most concerning as it increases her risk for chronic disease? A, blood pressure. B, cholesterol. C, waist to hip ratio. D, physical activity level. Or E, A1C. What do we think?
Oh goodness, you got a lot of C's and E's. Or you
C's
got a
and
couple,
E's.
you got E's. I put a C and an E because that waist to hip ratio is for chronic disease, but that diabetes is really bad.
Mm-hmm. All right, let's see
So,
what it is.
diabetes.
A1C.
Yes.
Yeah. Okay. Good job. All right. Here's another one. A 52-year-old male client just submitted their well-being assessment prior to their first coaching session. The client's information includes the following. They're self-employed, lives with young son, on medication for high blood pressure and chronic pain, insufficient sleep 19 out of the last 30 days, blood pressure 112/64, total cholesterol 170, BMI 23. The physical activity, he runs 40 minutes 5 times per week, also does strength training 3 times per week, including all major muscle groups, and he eats 10 servings of fruits and vegetables per day. Which of the following would the coach possibly note for follow-up per recommended health guidelines? A, sleep. B, BMI. C, fruit and veggie intake. D, blood pressure. Or E, total cholesterol.
We've got a lot of A's.
A's. All right. Yes. So per CDC, if you're an adult or child, high cholesterol is having a total cholesterol above 200. We went over that. Was that last week, I think? This condition
Yes.
is also called hyperlipidemia. So the correct answer is sleep. All right, so this is a bonus section, some other helpful information to help supplement the Section 3 competencies. All right, so optimal total cholesterol is 150, but it's not considered high unless it's 200 per the CDC. We talked about this last week. In the optimal cholesterol levels, optimal is 150, LDL 100, HDL at least 50 in men, 50 or 40 in men, 50 in women, triglycerides less than 150. All right, symptoms of diabetes. So if you have any of the following diabetes symptoms, see your doctor about getting your blood sugar tested. Urinate a lot often at night. You're very thirsty. You lose weight without trying. You're very hungry, have blurry vision, have numb or tingling hands or feet, feel very tired, have very dry skin, have sores that heal slowly, have more infections than usual. And type 1 diabetes may also have nausea, vomiting, or stomach pains. Type 1 diabetes symptoms can develop in just a few weeks or months and can be severe. It typically starts when you're a child, teen, or young adult, but it can really happen at any age. And type 2 symptoms take several years to develop. Some people don't notice any symptoms at all. Type 2 diabetes usually starts when you're an adult, though more and more children and teens are developing it. Because symptoms are hard to spot, it is important to know the risk factors. Okay, some more on waist circumference. All right, another way to estimate your potential disease risk is to measure your waist circumference. Excessive abdominal fat may be serious because it places you at greater risk for developing obesity-related conditions such as type 2 diabetes, high blood pressure, and coronary artery disease. Your waistline may be telling you that you have a higher risk of developing obesity-related conditions if you are a man whose waist circumference is more than 40 inches, and a non-pregnant woman whose waist circumference is more than 35 inches. And just a little note, the waist to hip ratio is the best tool to measure visceral fat. Right, stroke. Signs and symptoms: sudden numbness or weakness on the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause. And the risk factors: high blood pressure, high cholesterol, heart disease, diabetes, obesity, sickle cell disease, too much sodium, physical inactivity, poor diet, smoking, excessive alcohol, genetics, and age, gender, and race, African American and Pacific Islander. All right, the ABCs of stroke. Aspirin may help control the blood pressure, manage cholesterol, and stop smoking. Right, elevated blood pressure. Elevated blood pressure is blood pressure that is slightly higher than normal. High blood pressure usually develops over time. High blood pressure that is slightly higher than normal increases your risk for developing chronic or long-lasting high blood pressure in the future. If your blood pressure is between 120/80 and 129/80, you may have elevated blood pressure. Learn more about how blood pressure is measured. You can take steps to manage your blood pressure and keep it in a healthy range. Diabetes: about 6 out of 10 people who have diabetes also have high blood pressure. Diabetes causes sugars to build up in the blood and also increases the risk for heart disease. All right, let's see. I can't really read the top. Oh, sorry, let me go back. Your lifestyle choices can increase your risk for high blood pressure. Unhealthy diet, a diet that is too high in sodium and too low in potassium, puts you at risk for high blood pressure. Eating too much sodium increases blood pressure. Most of the sodium we eat comes from processed and restaurant foods. Physical inactivity, getting regular physical inactivity helps your heart and blood vessels stay strong and healthy, which may lower your blood pressure. Regular physical activity can also help you keep a healthy weight, which may also help lower your blood pressure. Obesity, having obesity is having excessive body fat. Having obesity or overweight means your heart must work harder to pump blood and oxygen around the body. Over time, this can add stress to your heart and blood vessels. Obesity is linked to higher bad cholesterols and triglyceride levels and to lower good cholesterol levels. In addition to high blood pressure, having obesity can also lead to heart disease and diabetes. Too much alcohol. Women should have no more than 1 drink a day. Men should have more than 2 drinks a day. And of course, tobacco use increases your risk for high blood pressure. Smoking can damage the heart and blood vessels. Nicotine raises blood pressure, and breathing in carbon monoxide, which is produced from tobacco, smoking tobacco, reduces the amount of oxygen that your blood can carry. All right, osteoarthritis, or OA, is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. With OA, the cartilage within a joint begins to break down and the underlying bone begins to change. These changes usually develop slowly and get worse over time. OA can cause pain, stiffness, and swelling. In some cases, it also causes reduced function and disability. Some people are no longer able to do daily tasks or work. What are the signs and symptoms? Pain or aching, stiffness, decreased range of motion or flexibility, and swelling. OA is caused by damage of breakdown of joint cartilage between the bones. So what are the risk factors? Joint injury or overuse, such as knee bending and repetitive stress on a joint can damage a joint and increase the risk of OA in that joint. The risk of developing OA increases with age. Women are more likely to develop OA than men, especially after the age of 50. Extra weight puts more stress on the joints, particularly weight-bearing joints like the hips and knees. This stress increases the risk of OA in that joint. Obesity may also have metabolic effects that increase the risk of OA. People who have family members with OA are more likely to develop it. People who have hand OA are more likely to develop knee OA. And some Asian populations have lower risk for osteoarthritis. Nice. There's lots of risk factors to determine a person's risk of developing rheumatoid arthritis. Age can begin at any age. The chance of developing RA increases with age. The onset of RA is highest among adults in their 60s. Women are 2 to 3 times more likely to develop rheumatoid arthritis than men. Multiple studies show that people who smoke have a higher risk of developing RA. It can also make the disease worse. Women who have never given birth may have a greater risk of developing RA. Some early life exposures may increase risk of developing RA in adulthood. For example, one study found that children whose mothers smoked had double the risk of developing RA when they were adults. Being obese can increase the risk of RA. People born with specific genes are more likely to develop RA. And these genes called HLA, class 2 genotype, can make your arthritis worse. The risk of RA may be highest when people with these genes also smoke or have obesity. At least one characteristic may decrease risk of developing RA, breastfeeding. Women who have breastfed their infants have decreased risk of developing RA. The complications of RA, premature heart disease, obesity, and employment. Signs and symptoms of RA. Pain or aching in more than one joint. Stiffness in more than one joint. Tenderness and swelling in more than one joint. The same symptoms on both sides of the body, such as in both hands or both knees. Weight loss, fever, fatigue or tiredness, and weakness. All right, going through fibromyalgia. The risk factors include age. Fibromyalgia can affect people of all ages, including children. However, most people are diagnosed during middle age, and you are more likely to have fibromyalgia as you get older. If you have lupus or rheumatoid arthritis, you are more likely to develop fibromyalgia. There are other characteristics that have been linked to fibromyalgia, but more research is needed to confirm these relationships. These possible risk factors include women are twice as likely to have fibromyalgia than men, stressful or traumatic events such as adverse childhood experiences, car accidents, or PTSD, repetitive injuries, injury from repetitive stress on a joint such as frequent knee bending, illness such as viral infections, family history, and obesity. It is diagnosed using the patient's history, physical examination, x-rays, and blood work. The common symptoms of fibromyalgia are pain and stiffness all over the body, fatigue and tiredness, depression and anxiety, sleep problems, problem with thinking, memory, and concentration, headaches, including migraines. Other symptoms may include tingling or numbness in hands and feet, pain in the face or jaw, including disorders of the jaw known as TMJ, digestive problems such as abdominal pain, bloating, constipation, and even IBS. All right, so this is just a chart that shows the symptoms and the risk factors that we just went over. But if you go to this deck, this is just, I think, more helpful to print out rather than the other slides that I just went through.
And this is a great slide.
Yeah, like this slide. All right, and that's it.
That was awesome. Does anybody have any questions before she stops sharing her screen? Okay, I think you're set. If you want to stop sharing your screen, you did a fantastic job, Teresa.
All right, that was a lot of data.
It was, but it was really good because I'll be honest, this is what I haven't got into yet. So this is what I really needed to do. And it was a lot of work.
And yeah, I tried to go quickly because I wanted you guys to have all the information and I wanted to get through to those test questions. So, I skipped a few things, but I hope it was really helpful in a way that that works for you. So
I'm going to go ahead and stop recording. Oops. Do that every time.